Are lipomas always benign? I know what you mean, so I'm not going to be semantic about it. So I'm going to answer the question in the spirit of the question, which would require me to say no. Lipomas are not always benign. It is possible for lipomas to be cancerous. So it's very rare, but it is possible. And the reason I said about the semantic thing is because if a lipoma was cancerous, it would be called a liposarcoma. So it wouldn't be called a lipoma. So kind of by definition, if it's called a lipoma, it's benign. But basically what you're saying is, are all fatty lumps underneath the skin benign? And so, yeah, the answer is no, they're not all benign. The vast majority of lipomas are benign, though. So don't worry too much, because it's rare to get a cancerous lipoma, and there would usually be some telltale signs that it was cancerous, and those telltale signs would mean it would be hard, painful, kind of craggy edges, unusual, atypical, we might say. So those would be slightly unusual features of a lipoma that would make us think, is this not a simple lipoma? Usually they're quite soft, they're quite discrete, they're quite uniform. We will routinely send them off anyway for histology to ensure that it is benign. And even when it looks completely benign and completely innocuous, we send them off just because that's part and parcel of having the treatment. We will send it off for histology. But in a very rare situation, it is possible to have a cancerous lipoma. But as I say, the absolute, I'm trying to think, have I ever seen one? I'm not sure if I've ever seen I don't think I've personally treated anyone. I probably have, in training and stuff, probably, but I certainly can't really particularly remember it. So it's not a common thing, and yet, lipomas are extremely common. So don't go away and start worrying about your lipoma. But the answer to the question is yes, it is possible for a lipoma, or at least a fatty lump, to be cancerous. But as I say, if you have a lipoma or if you have a fatty lump and it doesn't particularly bother you, particularly if you've had it investigated, you had a scan and had an examination, what have you, they told you it's a lipoma, it doesn't necessarily need to be removed because you're worried it's cancerous, unless, as I say, there's atypical features. But if there are no atypical features, it's been seen, particularly if it's been scanned, and it doesn't bother you, it doesn't necessarily have to be removed, because it is very unusual for them to become cancerous. And if they do, there are usually signs of them being cancerous, which means they're unusual in some way, which you would think be things like pain and it feeling a bit hard, which is not normally associated with lipoma.